I'm a double board certified facial plastic surgeon, and today I'll be shedding light on Millie Bobby Brown's facial transformation over the past few years. But before I do my analysis, let me first react to Millie's recent Instagram post.
I grew up in front of the world, and for some reason, people can't seem to grow up with me. Instead, they act like I'm supposed to stay frozen in time, like I should still look the way I did on Stranger Things Season 1. And because I don't, I'm now a target. One article reads, "Why are Gen Zers like Millie Bobby Brown aging so badly? What has Millie Bobby Brown done to her face? Millie Bobby Brown mistaken for someone's mum as she guides younger sister Ava through LA. This isn't journalism. This is bullying."
Specifically, I have three main points to make. In her video post, she brings up a few journalists and some of the articles that they posted about her appearance. And the summary of these articles is as follows: that Gen Z is exposed to a constant stream of filtered and edited images, creating unrealistic beauty standards. Cosmetic treatments like filler are creating a more aged appearance, with people looking more alike. And even excessive skincare can cause irritation and damage to our skin, also leading to more aged appearances. And that is, by the way, when I talk about skincare, I promote a more pared down approach to skincare, specifically focusing on products that are hypoallergenic and that promote the hydration of our skin without causing irritation. And one of our best-selling Feel Confident products does just that. That's the HA serum that we have. Make sure to check that one out. Point number 2 has to do with what Millie said in the past about growing up as a child star. "You cannot speak on children that are underage," she said. "I mean, our brains physically have not grown yet. To diminish and practically stunt someone's growth mentally, strip them down, tell them, hey, listen, you don't look that great. Why are you wearing that? How dare you think you can wear that? How dare you say that?" But I think that any parent allowing their child to be a child star needs to carefully consider the ramifications of that decision. Once people are out in the public eye, people will of course talk, especially now with so many social media platforms available. I agree with protecting our youth's mental health, but that I believe is best done by keeping our youth out of the public eye in the first place. Point number 3 relates to anyone being a celebrity. That comes with people commenting and speculating about their every move. And that often includes their appearance. But it's not necessarily from a place of evil or someone being ill-spirited. Often it's based on people's intrigue and curiosity with that celebrity, or to explain a recent trend that has the potential to influence millions of other people. Celebrities yield massive influence, and with that comes enormous responsibilities. Their appearances and how they achieved it can discourage or promote certain styles or procedures, even if they don't admit to having had anything done. On one hand, we should respect a celebrity's privacy to not disclose an aesthetic procedure. But on the other hand, if they did disclose it, it would allow other people to see how they could potentially achieve a similar look, or what they might want to avoid. Where the public lacks information, they will fill it in, sometimes incorrectly. Well, here's my attempt at educating the masses about Millie's beautiful face. In 2020, at the age of 16, you can see that Millie has very proportional horizontal thirds of her face. She has full eyebrows, supratarsal show, and infrabrow fullness. She has some slight nasal tip bulbosity, which we know is normal. And she has strong upper and lower jaw structure. Her lips appear full, she has a short philtrum, and she has upper tooth show when she parts her lips and smiles. In 2023, at the age of 19, Millie has an M-shaped hairline. This is a common, normal variant of a female hairline. Sometimes we see a more rounded appearance, and other times we see a more M-shaped appearance. Millie has normal-looking nasolabial folds. Remember that we all have nasolabial folds. She also has full upper tooth show on smile, and this is a favorable aesthetic trait. In 2024, at the age of 20, I see some signs of potential lip filler, and as we compare to 2019, we can see some slight lumpiness to the red lip. We also see that some of the material may be settling just outside of the vermilion border. Even in the best of hands, when it comes to lip filler, it's very easy for the material to migrate and to go to places where it wasn't exactly intended to be. And sometimes that happens at the time of the injections, and other times it just happens over the course of months to years after the filler was initially placed. There are, of course, certain techniques that might increase the potential for that filler settling outside of the red lip. And one technique that does just that is the Russian lip filler technique. As those injections are placed almost vertically and going through the vermilion border, some of the filler will settle out outside of that border. In 2025, at the age of 21, we can see that Millie is now experimenting with a new hair color, which looks great. Her lips continue to look different from, say, the SAG Awards from 2018. When we compare to this year's SAG Awards in 2025, we can see different proportions of her upper lip to her lower lip. In 2018, the lower lip was larger than the upper lip, but now in 2025, we can see that that ratio is essentially reversed, with the upper lip appearing slightly bigger than the bottom lip with the same 3/4 type of view. Her current lip proportions speak to the change in the ideal aesthetic over the last 7 to 10 years, which is that the upper lip to lower lip ratio being closer to a 1-to-1, or with the upper lip being slightly larger than the bottom lip, is now broadly accepted. With classic beauty standards, we usually would see that the bottom lip was larger than the upper lip, but now there's more of an acceptance for an even balance between the two, or the upper being slightly larger. I'm also seeing the potential introduction of cheek filler. As I look at Millie's medial cheek and lateral cheek, to my eye, they appear more prominent than they did in prior years. Now, could that be just the result of her getting older, or maybe some weight fluctuation? Of course that's possible, but it could also be the introduction of filler in that area. And there are a few options when it comes to cheek augmentation or enhancement. The most common way to enhance the cheeks these days is with HA filler or hyaluronic acid filler. You may have heard of Restylane or Juvederm. Those are types of HA filler that can be injected into the cheeks. When it comes to filling the cheeks with HA filler, usually a higher G' filler is selected because typically it's placed down onto bone. So you want a thicker substance that will closer mimic the bony type of structure. That's very different from injecting the lips, for example, because in the lips you want a low G' or a thinner type of consistency to the filler, because this is a more delicate area. And you don't want that thick filler that will look heavy and out of place in the lips. Another option for cheek augmentation is fat transfer. That's when fat is taken from areas like the belly or the thighs and first processed, then transferred to the face. The process of injecting the fat is actually similar to injecting HA filler. It's just a different type of filler that's your body's own tissue and usually lasts much longer than hyaluronic acid. Remember, with fat transfer, usually only about half of what's transferred survives. The rest of the fat essentially gets resorbed by the body. So typically you need to overcompensate with the filler that's being placed because you know half of it will go away. The tricky thing about fat transfer is that there's nothing you can use to dissolve it away. It's not like hyaluronic acid that has Hylenex that can be used to dissolve away the HA filler. With a fat transfer, you're essentially stuck with what you got unless you go and surgically remove fat deposits that you're not happy with after they've settled. Another type of filler that can be used to improve the cheek structure is Sculptra. This is a biodegradable and biocompatible substance that actually promotes collagen production. And we filmed a video with my PA about this very topic. If you want to learn more, make sure to check out that video. Another option to augment the cheeks is using threads. Threads are essentially made of dissolvable suture material, and they typically have these barbs on them that can pull and reposition the skin, and they're placed out laterally and they go down into the tissues and they can pull the cheek complex up. The problem is that the effects of the threads usually don't last very long. So people might be happy for a few weeks, maybe a few months, but then you have to continue to repeat that process. And like filler, they can cause problems like infection. With threads, you can also get some dimpling under the skin that can be quite annoying until the suture dissolves. But up until now, the discussion has been more about minimally invasive ways to augment the cheeks, but there are also more invasive surgical methods to augment cheeks. One approach for surgical augmentation of the cheeks is with a cheek implant. These are usually made of silicone, similar to breast implants, but they have very particular shapes that allow them to sit right in this region directly on the bone, and in so doing, they're giving additional shape and contour to the cheeks. And sometimes they can even make the lower eyelid to cheek transition more smooth, reducing the appearance of that hollowing at the lower eyelid. These implants are surgically placed directly on the bone through incisions made inside the mouth. Nowadays, it's possible to get a CAT scan and to get 3D printed implants that are properly planned to your bony anatomy before surgery. So when your surgeon goes in to place the implant, there's already a plan in mind and there's a more perfect fit of implant to your cheek compared to basically having to sculpt an off-the-shelf product. These more custom-fitted implants are basically the state of the art when it comes to cheek implants. One of the main issues with cheek implants is that as our faces mature and change with time, sometimes you need to change out those implants because it no longer makes sense with the modified anatomy that you get from the aging process. And then, of course, there's the surgical facelift. Facelifts have the potential to take the cheek complex that has descended and usually medialized and to redrape and place it back to where the fat came from, which is usually on that upper lateral cheek. So there have been studies on this, and it's been found that facelifts usually bring in at least 2 cc's on average to that cheek complex. So even without additional HA filler or fat, just having the facelift alone can restore the cheek area. And there has been a trend towards younger and younger patients getting facelift surgery, and I've definitely raised concerns about this trend. My biggest fear is that as younger and younger people get more invasive cosmetic plastic surgery on their face, they're going to continue to want to get more and more surgeries. So by the time they're older, they will have had so many more procedures that now there's more scarring. Now there's more potential for risk, like nerve injury, like bleeding risk, and that risk will compound over time. So in general, I think it's better to start these cosmetic surgeries, if you're going to start them at all, later in life and not rush to do them too soon. Also, younger patients need time to mature for their ideas to come together for how they feel about themselves. And a lot of times I find that if you just wait and give them time to figure out how they feel about themselves, about their appearance, about how other people view them, usually some of those early desires will start to fade away. And they'll sometimes realize that, hey, I actually don't need that at all. And so I think rushing into doing facelift surgery on very young patients is problematic. And then, of course, there are some patients who get a combination of these different treatments. They might get a cheek implant and a lift, or they might get a lift with some fat transfer, or they get some HA filler and then later on they come back for some Sculptra, for example. But all of this to say that there are options when it comes to cheek augmentation if that's what someone is looking for. On this channel, I dissect faces not to bully and criticize, but rather to educate the masses on what is achievable with today's procedures and technologies. I think that everyone deserves to have the information and access to the same things available to celebrities. Speculating on whether or not a procedure happened or if aging effects happened is very different from passing judgment on how good or bad it looks. But I understand that not everyone commenting on the looks of celebrities has these same intentions in mind. And sometimes it can be ill-spirited and it can be mean, and I understand that that can hurt that celebrity's feelings. Listen, I get comments all the time on my channel about my lack of eyebrow hair, or how pale my skin looks, or that I look tired. I hear all that, I see all that, so I understand that when you amplify it by, millions more being interested in, let's say, Millie's personal journey, that can be very difficult to withstand, and we need to be respectful of that. But I want people to know how our faces are structured, how they change over time, and what options people have to look and feel their best. And if spreading that knowledge means covering some celebrities and discussing what may have happened, I will continue to do just that. But let's also continue to support Millie in her personal aesthetic journey. whether she does or does not do any procedures. But at the same time, her actions do not exist in a vacuum. And many young women, including eventually my daughter, are subject to influence by her and others like her. These are important dialogues that I think we should continue to have. Millie, if you ever want to sit down for a podcast style chat to discuss more with me about this topic, please let me know. You can have your team email us. And if you've enjoyed this video, please make sure to check out my reaction to Ariana Grande calling me out.